In this video, we're going to begin our discussion of microbial diseases. We're going to start with bacterial infections. Now, as mentioned in the previous video, bacterial infections can occur anywhere on the body. And as you're going through them, I want you to pay attention to what makes each disease a little bit unique. So look at those virulence factors. What does that bacteria do to defend itself against host mechanisms? What does the host do to help us defend against bacterial infections? What are some of those notable factors? So what are the signs or symptoms, or how do we treat it, etc.? Now, there's hundreds and hundreds of different kinds of bacterial infections, but we're only going to look at 10 in this class. We're going to divide this bacterial disease discussion into a couple of different videos, and the first one here we're going to start with is looking for the general infections of staph infection and strep infection. So let's begin with our staph infections. Now, when we talk about staph, of course we're referring to the bacterium in the genus of Staphylococcus. Now, one of the things you have to recognize about Staphylococcus is that it's found on the body as part of the normal microbiota. So on your skin in particular, you can find Staphylococcus. Now, it's not going to be a problem at all, but it's what happens when somehow you breach that first layer of defense and you do damage and wound that skin, and all of a sudden the integrity of it becomes disrupted. So then that bacteria is able to get into the skin. So it's an opportunistic bacterium. So once it gets into those deeper tissues like the lungs and the blood and the heart, then it's got the potential to cause disease and illness. So, what kinds of diseases can you associate with staph? Boils, pustules, erysipelas, impetigo, and even what most of you have probably heard of as MRSA, which is that methicillin-resistant Staphylococcus aureus. So, again, what's the causative agent when we're referring to staph? Staph infections are caused by the genus Staphylococcus. Now, although there's many kinds of Staphylococcus, the most common one when we're talking about diseases is going to be Staphylococcus aureus. Now, do recognize that staph is going to be a gram-positive and it's cockle in shape. In the case of Staphylococcus, though, it's going to be clustered. Now, Staphylococcus is going to be considered a super antigen, and because it's a bacteria, so it's a foreign object getting into the body, obviously it's going to be an antigen. But the reason we give it the term super antigen is because of the speed and the strength of the inflammatory responses within the body that this bacteria can invoke. So, what are those virulence factors that help lead to the pathogenicity? In the case of Staphylococcus, it's going to use various enzymes and exotoxins. Such enzymes as hyaluronidase, coagulase, DNase, lipase, staphylokinase. So these are going to be ones that are going to disrupt the integrity of the tissue of the host, such as with hyaluronidase, or with metabolic processes such as DNase, lipase, examples. Now, it's also going to be able to produce toxins, and these are going to be those exotoxins. So such toxins as toxic shock toxins and exfoliative toxins, or even hemolysins, which is going to be a toxins against the blood cells. And finally, it also has something known as protein A on its surface. So what protein A does is it's going to bind to the host host's immunoglobulins, which remember are the antibodies. And when that protein A binds to the immunoglobulins or to the antibodies, it prevents that antibodies from inducing the opsonization response in the macrophages. So literally it's helping that Staphylococcus bacterium with protein A, it's helping it hide from the body so that it's not going to be able to be phagocytized and cleared out in that cellular initial response. So what happens with a staph infection? Again, it's going to have a portal of entry. Generally, it's going to be through the skin, through when you have a wound, a cut, something like that. It's going to get into that deeper tissue. It's going to establish itself. It's going to begin to multiply. And then once it becomes multiplied and it's established, then it starts to secrete those enzymes and toxins. And remember in the steps of pathogenicity that part of the steps is you have to be able to do damage to the host. So those enzyme and toxins, that's what's going to do that tissue damage. And then that's going to lead to the inflammatory response. And as I said, this is a super antigen, so that inflammatory response is going to be rapid and it's going to be strong. And so once you get inflammation, that means you're going to start having an accumulation of fluids and cells and debris and proteins such as fibrin to the site of that infection. And so because it's so strong and so rapid, what you're going to see is that the skin rapidly becomes distended from the edema. And because of all those cells in the pus, you're going to start seeing pustules form. And so as that area grows and you start getting those lesions, then eventually that pustule is going to rupture, it's going to drain out, and then hopefully the body's healing responses are going to be able to begin and one is going to be able to recover. But these are kind of just some images that you'll see of typical kind of staph infections. So this is actually from MRSA, and again you see that redness and that swelling that you get from the inflammatory response, and that in this case the pustule has ruptured. Over here you get the redness and the swelling, and the pustules have already ruptured, and so you got scabbing and it's beginning to heal. And this picture I put in here to demonstrate that exfoliative toxin, because you can see that the skin is peeling off or becoming exfoliated. So how do we treat staph? Well, one of the things we have to do is ensure that it's staph through either a coagulase test or a blood agar, and we're going to treat it with antibiotics. And there's a wide variety of antibiotics that are effective against staph. Now, if it happens to be MRSA, which is that methicillin resistant strain of Staphylococcus aureus, then it's probably going to be a multi-antibiotic regimen, and we're going to have to pick those antibiotics to ensure that it's not part of that methicillin family, since that strain of Staph aureus is going to be resistant to it. So that is our staph infections. Now let's swap gears and let's talk a little bit general again about the streptococcus infections. Now, similar to what we discussed with staph, is that strep is going to be found on the body as part of its normal microbiota. So it is going to be found in particular like in the nasal cavity. It can be found on skin and things like that as well. And again, it's going to be fine as long as that tissue in that first line of defense doesn't have any breaches in it and still intact. But once that strep can get inside, it can lead to a variety of diseases, such as streptococcus can lead to strep throat, which is known as pharyngitis, can lead to scarlet fever, impetigo, things such as that. Now, strep is caused by, again, that genus known as Streptococcus bacteria, and it's going to have one that is more common than others in causing diseases, and that's the Streptococcus pyogenes. Now, like staph, strep is going to be a gram-positive bacterium, but it's not going to be found in clusters. It's going to be in chains or in pairs. Now, strep has its own unique group of virulence factors, but the one that we're most associated when we think of strep, and you did this in lab, for instance, is you look at those hemolytic properties, which means it's going to be able to lyse the blood cells. So we had alpha, beta, and gamma hemolytic properties for strep. So remember, beta is the one that means that it's going to have full lysis, so that when it's releasing those toxins that are going to be hemolytic toxins, it's going to lead to full lysis. And because that is the most virulent, we further subdivide or classify those by their serotypes, and we call those the Lancefield serotypes. So we have A, B, C, D, and G, with A, B, and G being ones that you'll probably hear more often. So virulence factors, the hemolysins, which are those hemolytic toxins that we were just discussing, but also they can release what are known as the erythrogenic exotoxins. Now, erythro, same thing for like erythrocyte, because it means redness, and the whole reason of these toxins is you're going to definitely see their effects because of the redness and the rashes that can come from those. In addition, they have, just like staph, had a lot of toxic enzymes. Strep can release toxic enzymes such as streptokinase, streptolysin, DNase, which can then again destroy or help to do damage to the host connective tissues or to their metabolic process. So out of all those serotypes, the one that's the group A, so it's group A streps, sometimes you hear it referred to as the gas, also have a unique feature in the fact that they have a hyaluronic capsule kind of to around that cell that helps prevent it from becoming phagocytized. So it's just one way that it's going to help defend itself against host defense mechanisms. In addition, we talked about having the A protein for staph. Well, in the case of strep, it has the M proteins and lipoteichoic acids. And now those are going to end up helping those strep cells come in and adhere to the host tissue cells so that it's going to be able to help it hang on tightly, and it's going to prevent fluids and stuff from like coughing and things like that from being able to dislodge it and get rid of it. And it also helps that cell not be able to be phagocytized. So again, lots of different virulence factors, and we're just picking out a few to highlight. So how does strep work? Strep is going to enter generally through the respiratory tract, through droplets, or through the fact that you're going to have some kind of skin damage. The bacteria is going to localize, and generally it's going to localize on those mucous membranes, the places that you're thinking about it, because the most common one that comes to mind is strep throat, and that's because those tonsils are a common place for strep to localize, or in that throat region, which is the pharynx. So you're going to get the bacterial cells in, they're going to colonize, and then once they become established, they're going to start to secrete those toxic enzymes and toxins. And then that's going to lead to that inflammatory process. And just like we discussed with staph, in the inflammatory process, then that means you're going to have an accumulation of fluid. So you have edema, you're going to have the redness, especially in this case because of those erythrogenic toxins. You're going to have the pus because of the influx of cells that are going to come in. So you're going to start to see things like fever, pain, and in particular because of it being in the tonsil area, you're going to start to see those enhanced or enlarged lymph nodes. So again, some of the diseases that you can associate with strep are going to be the strep throat or pharyngitis, rheumatic fever, acute glomerulonephritis, which is going to be of the kidneys, as we said, impetigo and scarlet fever as well. And so just like with staph, we're going to treat strep with a wide variety of antibiotics, and then depending on the level of virulence with that strep, it may be a multi-regimen as well. So, staph and strep are quite similar in a lot of ways. So just kind of some comparisons here. Just remember with a staph infection, it is going to be caused by Staphylococcus, with the main one being Staph aureus. Strep is going to be caused by Streptococcus, with the main one being S. pyrogenus. And then you're going to have serotypes A, B, D, G, for instance. So different kinds of diseases, but even though they do have some, because of what that disease is, like impetigo being an infection of the skin, that they can both contribute to that. Similar in the fact that they are having both toxins and enzymes in their virulence factors and having a specific protein, but a little bit different in what those toxins and enzymes are. So staph, of course, is going to have hemolysins, but it's going to have an exfoliant toxin, and it's going to use protein A. Strep also has those hemolysins, but it's going to have a much greater hemolytic effect, and it's got those erythrogenic toxins and the M proteins. Staph primarily comes in through skin that has been broken, where strep is going to be through respiratory droplets or even the skin. Okay, so that's the first discussion that we're going to have on diseases that are related to the bacterial infections. There will be a couple of other videos as well dealing with bacterial infections, so look for those as well.